Hello everyone and welcome once more to my channel, Background Health. On today's episode, I'll be discussing breast cancer, a disease that is predominantly diagnosed in women but not exclusively. Men too can have breast cancer. However, I'll be focusing on women. But before I do so, please join me as we watch this video, and at the end of the video, I'll come back and we discuss some important facts that you should know about this cancer.
The story I didn't want to have to tell you. But Ananda Lewis, the former MTV VJ and host of Teen Summit turned content creative, and my beautiful friend, mother, sister, and daughter, has died after years of living with breast cancer. Last year, we brought you the story of three friends. CNN Stephanie Elam brought myself and Ananda Lewis together to discuss how we were both dealing with stage 3 breast cancer differently. I took the traditional route of a double mastectomy, chemo, and radiation. Ananda decided against the double mastectomy and decided to take a different treatment route.
My plan at first was to get out excessive toxins in my body. I felt like my body is intelligent. I know that to be true. Our bodies are brilliantly made. I decided to keep my tumor and try to work it out of my body a different way. Looking back on it, I go, you know what? Maybe I should have. Ananda completely overhauled her diet, improved her sleep, pursued aggressive therapies along with traditional medicine and radiation. She improved for a long time. She says removing the toxins, physical and emotional, from her body has been beneficial. She found out her cancer had metastasized into stage 4, which means the cancer spread to other areas.
Now that we have come back after watching that video, I want to give you the following fact. 90% of women diagnosed with breast cancer do not have a family member with previous breast cancer. In other words, you don't have to wait, or just because a family member doesn't have breast cancer doesn't mean your risk is low. Number two, the most important way to diagnose breast cancer is through mammogram. There are so many different recommendations, but the most popular recommendation is the American Cancer Society, which recommends that women get mammogram based on their age risk factors. However, there's another recommendation by the United States Preventive Services Task Force. That recommendation states that women between the ages of 40 and 74 undergo mammogram every 2 years. However, depending on your risk factor, if you're at higher risk, you may need to undergo annual mammogram. Other tests may need to be done, such as ultrasound or MRI, depending on other tests, including history of previous abnormal mammogram. Some may undergo genetic counseling and genetic testing if they are at risk to have genetic form of breast cancer. The second thing is, don't wait to have symptoms. If you have symptoms, it may be too late. The disease may have gone from a treatable stage to a less treatable and possibly deadly stage. Next is the fact that most societies no longer recommend monthly breast self-exam. Does not mean that you should not test yourself and check your breast periodically. If you find a lump, please bring it to the attention of your doctor as soon as possible. Other things to watch for include changes in the color of one or more of your breasts, discharge from your breast, especially bloody discharge, dimpling on one or more of your breasts, including inversion or retraction of your nipple where it begins to turn inwards, or lymph nodes in one of your armpits. Any one of these could be suggestive although not diagnostic. Now, if you're unfortunate to have been diagnosed with breast cancer, the most important thing to do is not to delay. Do not procrastinate. It is okay to Google and research for yourself a number of information. However, do not delay. The other most important thing you could do is to listen to your doctor, the expert, the oncologist. Find out what their recommendation is and please follow it. This disease is too complicated, too complex for you to think you can make the decision on your own by Googling things. Next question is, are there some things you can do to reduce your risk factor for breast cancer? Yes. Reducing your weight, exercising regularly, not smoking, avoiding alcohol or minimizing it to no more than 1 drink per day. Next, if you're a woman and you take birth control pills such as estrogen, that can increase your risk of breast cancer. Some women take estrogen for menopausal symptoms such as hot flashes. If you do so, please know that it may increase your risk of breast cancer. In conclusion, most women with breast cancer do not have family history of breast cancer. Do not wait for symptoms to develop. Get mammogram as recommended. Listen to your doctors. And remember that early disease is treatable, and majority of women in stage 1, stage 2 can go to remission and live many years disease-free and even die of other things other than the cancer. Please do not delay. Save yourself. Be protective of yourself. Thank you. Until next time.